Did you know that we have a fully functional radiology department at Equipped Hospital? It works 24/7 from Monday to Sunday. At Equipped, we offer a wide range of services of ultrasound and X-ray, but particularly today we are going to talk about X-ray services. Do you need a fast, affordable, and reliable X-ray? We got you covered. At Equipped, we offer a wide range of X-ray services, including skull X-ray, neck X-ray, chest X-ray, X-ray of the abdomen, the back, the pelvis, the upper limbs, and the lower limbs. We also offer special contrast examinations, including hysterosalpingography, known as HSG, cystourethropy, known as CUG, and barium contrast studies. Specifically, HSG stands for, as the word is, hysterosalpingography. Hystero stands for the uterus, salpingo means tubes, and graphy is simply means image. So, in other words, we are imaging the uterus and the tubes. Infertility is a key problem within Uganda, and most of the infertility issues arise from uterine problems and tubal problems. In hysterosalpingography, we image the uterus and the tubes to look at your tubes if they are open or closed. So, the image that we produce and the results that we give you will help the gynecologist find out a solution. You are struggling with infertility, you can come to Equipped and we can test your tubes and uterus and give you hope of getting a baby. CUG simply stands for cystourethropy. Again, as you hear the word, cysto stands for the urinary bladder. Urethra comes from the urethra, the tube that brings out urine in men. Then graphy is the image. So, cystourethropy is specifically for men, though also done in women. But we are specifically looking at the urethra, at the urinary system of the body. We are looking at the urinary bladder, the urethra. So in men, most of the problems are caused by infection, trauma. If your urethra has a problem and it narrows, so you get difficult in passing urine, and actually you might even get problems of infertility. At Equipped, we also do barium studies. Barium studies look at the system that takes food from when we eat to when it gets out. During barium studies, we have four types of contrast studies of barium. We have what we call a barium swallow. Typically, the barium swallow looks at the esophagus, the pipe that takes food from the mouth to the stomach. During a barium swallow, you are given a suspension of barium sulfate solution that you drink, and you take images using an X-ray. So, this medicine coats the esophagus. As it goes down, we can see the entire esophagus if it has problems. In the barium swallow, we can rule out diseases like cancer of the esophagus, strictures of the esophagus, and poor contraction of the esophagus. Barium studies also look at the stomach, what we call a barium meal. Why do we do a barium meal? Most people have ulcers, which are deep penetrating. Ulcers are wounds within the stomach layer. So when we do a barium meal, we can image your stomach and see the complications of the stomach, like ulcers, herniation of the stomach into the chest, gastric valvulus, that is when the stomach twists, and also narrowing of the pylorus, the pyloric antrum, the opening of the stomach to the intestines. Again, from the stomach, we also image the small intestines, what we call a barium follow-through. In the small intestines, we can also see pathologies or diseases like cancer of the small intestines and also inflammation of the small intestines. We also image the large bowel, that is the big intestine that takes out food up to the outlet. In the barium enema, we introduce the barium sulfate through the anal canal, look at the large bowel and rule out pathology like cancer of the large bowel, polyps, diverticulosis, or inflammation of the large bowel. If you come to Henrop Hospital, you will receive all the services that I've spoken about. At Henrop Hospital, we are the eye of medicine.